Next thing, we move on to the next topic, which is grafting. Hope you all know, you might have a fair idea of what is a grafting, right? A flap and a graft. A flap has a viable vascular supply, whereas a graft does not have a, it does not have the vascularity from its original site. So that's the difference between a flap and a graft. So there are various types of grafting like epidermal, dermal, full thickness skin graft, split thickness skin graft, and a skin substitute graft. So when you go to epidermal, the physician is going to place only the epidermis. So it is a dermal. It all depends on the anatomic sites and the total surface area that is going to be treated. So it is all pretty simple. The difference between FTSG is that in a split thickness, it's not the entire layer of the dermis is being taken, a substantial layer of the dermis is being taken. Okay, whereas in a full thickness, epidermis and the entire dermis is being taken for a repair. So that's the difference between a full thickness and a split thickness skin graft. Now, what happens is, if say for example, providers can also go for artificial, like synthetic substitute grafts. So we call them as skin grafts, especially for pressure ulcers, chronic debilitating ulcers, such wounds. They'll have to do constant debridement. Those times the physician applies some dressings. So those things we can take them as skin substitute grafts. In such cases, what you have to do is you will have to also code for the supply. Say if it is going to be a Primatrix, say if it is going to be an Alloderm, such synthetic substitute grafts should also be coded from your HIPEX book depending on the square centimeter that is being used. Okay.